Welcome to the IFM Board Certification Exam Review questions. My name is Dr. Jin Hee Park, and as an IFM certified practitioner who passed the exam back in July of 2025, I noticed many other health professionals who were studying for the exam felt very overwhelmed with the amount of study material to cover and had a difficult time passing the exam because they didn't know what to expect on the real test. So I realized the best way to prepare for the exam was to go through as many practice questions as possible to get comfortable with the test taking. So this video covers the sixth set of 10 AFMCP module multiple choice questions that are similar to what you'll see on the actual IFM board exam. Pause if you need some more thinking time, and let's begin. Question number 51. A patient's genetic predisposition to poor methylation, for example, an MTHFR SNP, would be categorized in which section of the functional medicine matrix and timeline? A. Clinical indicator. B. Mediator. C. Trigger. D. Antecedent. And the correct answer is D, antecedent. So antecedents are factors that precede the illness, such as genetics, congenital factors, or childhood experiences, which predispose an individual to certain imbalances. A is incorrect because a clinical indicator is a physical exam finding that is detected by the clinician, and this is an acquired factor. B is incorrect because mediators are ongoing factors, either biochemical or psychosocial, that contribute to the pathological changes or prevent resolution of these pathological changes. And this is also an acquired factor. C is incorrect because triggers are an incident that sets off the clinical imbalance. This is also an acquired factor that happens later in life. So overall, the correct answer is D, antecedent. Question number 52. In the ABCD nutritional evaluation, how is a functional test like an organic acids test distinguished from a standard biomarker like a serum glucose test? A. Functional tests are strictly used for genetic screening. B. Standard biomarkers are only used in conventional medicine. C. Functional tests measure the activity of metabolic pathways rather than a static level of a substance. D. Functional tests are always performed in a hospital setting. And the correct answer is C. Functional tests measure the activity of metabolic pathways rather than a static level of a substance. So functional tests assess how well a system is working, for example, enzyme efficiency, rather than just measuring the amount of a nutrient in the blood. Consider whether the test looks at a single snapshot value or the flow of a chemical process. So a single snapshot value would be more of a conventional standard biomarker, whereas looking at the flow of a chemical process would be considered a functional test. A is incorrect because functional tests are used for a variety of screenings such as nutritional status, hormone, neurotransmitter, gastrointestinal map, enzyme efficiency, etc., not just the genetics. B is incorrect because standard biomarkers are used in functional medicine as well as in conventional medicine. D is incorrect because functional tests are not always performed in the hospital setting. They're more likely to be performed in the outpatient clinic setting. Okay, so the overall correct answer is C. Question number 53. Which of the following would be mapped to the communication node on the functional medicine matrix? A. Heavy metal toxicity and phase 1 clearance. B. Thyroid hormones and neurotransmitters. C. Digestive enzymes and bile salts. D. Capillary permeability and lymph flow. And the correct answer is B. Thyroid hormones and neurotransmitters. So the communication node covers the transmission of signals throughout the body, including hormones, neurotransmitters, and cell signaling molecules. A is incorrect because metal toxicity and phase 1 clearance has to do with biotransformation and elimination node. C is incorrect because digestive enzymes and bile salts have to do with the assimilation node. D is incorrect because capillary permeability and lymph flow have to do with the transport node. So overall, the correct answer is B, thyroid hormones and neurotransmitters. Question number 54. During the tell phase of the go-to-it heuristic, the clinician's primary task is to A, tell the patient exactly which drugs to take. B, terminate the encounter if the patient is non-compliant. C, retell the patient's story using the matrix to ensure alignment and build a therapeutic partnership. D, test the patient's memory of their own history. And the correct answer is C, retell the patient's story using the matrix to ensure alignment and build a therapeutic partnership. So the tell phase is a rapport building phase. So by reflecting the patient's story back through a functional lens, the clinician validates the patient's experience and checks for accuracy. And this step involves the clinician acting as a mirror for the patient's narrative. So all the other answer choices A, B, and D are irrelevant. So the correct answer is C. Question number 55. A patient with chronic skin rashes and joint pain is being evaluated. If these symptoms are perpetuated by circulating immune complexes, where would this be mapped on the functional medicine matrix? A, assimilation. B, defense and repair. C, structural integrity. D, energy. And the correct answer is B, defense and repair. So immune complexes, inflammation, and autoimmunity are the core concerns of the defense and repair node. A is incorrect because assimilation node has to do with the GI system and the respiratory tract. C is incorrect because structural integrity node has to do with barriers and structures of cells, tissues, and organs. D is incorrect because the energy node has to do with the mitochondrial function and oxidative stress. So overall, the correct answer is B, defense and repair. Question number 56. In the context of Moni Klaas's lecture, what is the role of centering for the practitioner? A, to memorize more medical facts during the encounter. B, to move from a state of doing to state of being to better facilitate the environment of insight. C, to physically move to the center of the exam room. D, to ensure the clinician maintains a position of absolute authority. And the correct answer is B, to move from a state of doing to a state of being to better facilitate the environment of insight. So centering allows the practitioner to be fully present, which is necessary for the patient to feel safe and experience insight. A is incorrect because centering has more to do with building a rapport with the patient rather than memorizing medical facts. C is incorrect because centering is more of a psychological presence rather than physical location in the exam room. D is incorrect because centering aims for building a collaborative relationship with the patient rather than maintaining a position of absolute authority. So overall, the correct answer is B. Question number 57. Which of the following is an example of a clinical indicator of B vitamin deficiency? A, glossitis with a smooth and red tongue. B, a history of low leafy green intake. C, a BMI of 32. D, elevated homocysteine on a lab report. And the correct answer is A, glossitis with a smooth and red tongue. So physical findings during an exam, like changes to the tongue or skin, are classic clinical indicators of nutritional status. B is incorrect because a history of low leafy green intake would fit into the diet history category. C is incorrect because BMI fits into the anthropometrics category. And D is incorrect because lab value fits into biomarker. So overall, the correct answer is A, glossitis with smooth and red tongue. Question number 58. The go-to-it heuristic suggests that the initiate phase should focus on A, handing out a generic protocol used for all patients. B, focusing solely on the patient's chief complaint with a single medication. C, addressing modifiable lifestyle factors and creating a collaborative plan. D, the most expensive lab tests first. And the correct answer is C, addressing modifiable lifestyle factors and creating a collaborative plan. So initiating care starts with the foundational elements of the matrix, such as sleep, diet, and stress to create a baseline for health. A is incorrect because in functional medicine, the clinician prescribes a personalized treatment protocol for each patient rather than handing out a generic protocol for all patients. B is incorrect because in functional medicine, they look at the root cause, not just this chief complaint, and they use a variety of modifiable lifestyle factors, supplements, rather than just using one single medication. D is incorrect because labs are only ordered when it's essential and the cost is irrelevant. So overall, the correct answer is C. Question number 59. How does transformation differ from change in the clinical context of chronic disease management? A, there's no difference. The terms are used interchangeably. B, transformation involves a shift in identity and perspective, while change may be just a behavioral modification. C, transformation only applies to the clinician, not the patient. D, change is permanent, while transformation is temporary. And the correct answer is B. Transformation involves a shift in identity and perspective, while change may be just a behavioral modification. So change might be stopping a habit, but transformation is seeing oneself in a way that makes the new behavior natural and integrated. So think about the difference between doing something different, which is change, and being someone different, which is transformation. So A is incorrect because there is clearly a difference in the terms. C is incorrect because both change and transformation apply to the patient. D is incorrect because change is temporary while transformation is permanent. So overall, the correct answer is B. Question number 60. In the functional medicine model, spiritual health is assessed because it A, is a requirement for insurance billing. B, is only relevant for end-of-life care. C, allows the doctor to preach their own beliefs. D, influences the patient's resilience and their relationship to their disease. And the correct answer is D, influences the patient's resilience and their relationship to their disease. So spirituality and purpose are central to the matrix because they affect how a patient navigates chronic illness and their motivation for healing. A is incorrect because spiritual health is not a requirement for insurance billing. B is incorrect because spiritual health applies to all lifespans rather than just end-of-life care. C is incorrect because spiritual health focuses on the patient's own beliefs rather than the doctor preaching their own beliefs. So overall, the correct answer is D, influences the patient's resilience and their relationship to their disease. This was AFMCP module question set 6. If you're preparing for the IFM board exam, subscribe for more practice questions. And if you're wanting to get access to a 4 full-length 200-question practice exams designed to mirror the real IFM board testing experience, click the link below in the comments. And I'll see you in the next episode.